Ever wondered about the intricacies of a tracheostomy tube insertion? Welcome back to our channel, where we'll demystify this essential medical procedure. Whether you're a seasoned healthcare professional or a caregiver assisting a loved one, knowledge and understanding of this process are crucial for ensuring patient safety and comfort. Firstly, it's essential to grasp the fundamentals of what a tracheostomy tube is and its purpose. These tubes are hollow and inserted into the trachea to sustain an open airway. This aids breathing in patients who struggle with respiratory functions or clearing secretions. Start with the basics: preparation and assessment. Gather all necessary equipment such as the tracheostomy tube, obturator, suction catheter, sterile gloves and lubricant. Evaluate the patient's condition, obtain consent, and position them in a manner that optimizes airway access and visibility, typically a semi-Fowler's position. Now, on to maintaining a sterile technique. Thoroughly wash hands, don sterile gloves, and ensure a clean, sterile field for the procedure to minimize infection risks. Next, select and prepare the tube. Choose an appropriate tracheostomy tube size based on the patient's anatomy and clinical condition. Assemble the tube with the obturator in place, ensuring it's securely attached. The insertion procedure follows. Hold the tracheostomy tube with the dominant hand and the obturator with the non-dominant hand. Gently insert the tube into the tracheostomy stoma at a 45-degree angle, directing it towards the feet. Once the tube is inserted to the correct depth, remove the obturator with care. Confirm proper tube placement by observing chest rise and auscultating breath sounds. Securing the tube is the next step. Attach the tracheostomy tube ties or securement device around the patient's neck, ensuring a snug but not overly tight fit. Cut any excess ties to prevent obstruction or discomfort. Post-insertion care is vital. Monitor the patient closely for signs of respiratory distress or complications. Provide adequate humidification and suctioning as needed to maintain airway patency. Document the procedure, including tube size, insertion depth, and any complications encountered. Finally, follow-up and education are key. Provide thorough education to the patient and caregivers on tracheostomy care, including suctioning, tube changes, and signs of complications. Schedule regular follow-up appointments to assess the patient's progress and address any concerns. Mastering the skill of tracheostomy tube insertion is invaluable for healthcare professionals and caregivers alike. Following these guidelines step by step and practicing proper technique can ensure the safety and well-being of patients with tracheostomies. Remember, proficiency comes with practice and experience, so never hesitate to seek guidance and support from experienced practitioners. Thank you for tuning in and look forward to more informative content from our channel.